Terrific. So we are back, Senate Health and Welfare. We're looking at H91, taking testimony so we can understand the bill a little bit better from everyone's perspective and what we might need to do to make improvements. As I said before, we have testimony online, and if you do testify, it's great. Please get us your testimony. And then if you have submitted testimony and you haven't testified and you'd like to do that, let us know, let Kiki know, and we'll try to get as many folks in as possible. I do give you a warning that concise to the point of H91 is absolutely critical because our time is so really limited. And I do appreciate so far we've had some really good testimony. So we're going to start with Libby Bennett from Groundworks. Libby is here. Thank you for being patient.
Good morning.
Thank you. So I'm going to have our committee introduce ourselves once and then everybody knows who we are. So go ahead.
Great.
Senator Larry Hart, Orange County.
Sam Vitals, Orleans County.
Jenny Lyons, Chittenden Southeast. And Cummings, Washington County, and part of Lamoille and part of Orange. And Senator LaRock Gulick will be in. She represents Chittenden Central. Thank you for being here, Libby.
Thank you.
Introduce yourself and we'll listen to your testimony.
Wonderful. Thank you. Good morning. My name is Libby Bennett. I'm the Executive Director of Groundworks Collaborative. We offer food, shelter, and supportive housing services for over 5,500 people each year in Brattleboro. We operate a 40-bed, year-round, 24/7 overnight shelter. In that same space, we operate a daytime drop-in center that supports up to 100 people each day. We're also gearing up to break ground this summer on an additional 40-bed shelter to open in early fiscal year 2027. Our shelter and housing support programs together served 871 people last year. Our outreach team, in the nearly 14 months they've been deployed to the streets of Brattleboro, has engaged with over 270 unique individuals living unsheltered in our community. I want to thank you all for taking up the work of better understanding the potential outcomes of H91 as proposed. It is no secret that our current systems fall short of meeting the need for emergency shelter statewide. The system is already underfunded to meet the need. The current iteration of H91 shelves and dismisses the thoughtful year of work and recommendations from the General Assistance Emergency Housing Task Force and has the potential to inflict undue harm to the systems supporting Vermonters experiencing homelessness. The currently proposed H91 legislation seeks to decentralize funding for both the GA Emergency Motel Program and the Housing and Opportunity Grant Program that funds our system of shelters in the state. Shifting the responsibility of administering these programs to our regional community action partners does not solve the inadequacy of funding from the system overall. In this proposed restructure, there are additional organizations for funds to pass through, all of which will have needs for drawing down administrative funds to cover their important work and pay staff to run these vital programs. Without a significant increase in funding overall, this will decrease the amount of funding available for providing direct support services to people experiencing homelessness. This proposed wholesale restructure fails to recognize the skilled and substantive systems we have in place to provide meaningful support to Vermonters in some of the most vulnerable situations, and to do this work well. I'm here to ask for your consideration to rethink this proposal in a way that protects what is not broken.
Sorry. Oh my God, there's no air.
I have no doubt that shifting administration of the GA Emergency Motel Program to a regional model would be well handled by our community action agencies. The GA program has shown us time and time again that it has numerous and significant flaws in the effort to keep vulnerable Vermonters sheltered. However, the well-functioning shelter system that has been closely regulated by the state's Office of Economic Opportunity who hold shelters accountable through habitability inspections, setting safety standards, and through both fiscal and programmatic monitoring, deserves your critical attention. Please ask yourselves, why are we making changes to a system that is providing high-quality services to Vermonters experiencing homelessness? The Office of Economic Opportunity, OEO, plays a critical role in the provision of technical assistance to shelter programs throughout the state, making our programs stronger and safer, with robust training, monitoring, evaluation, and standard setting that allows all Vermonters to access robust services when utilizing shelters in Vermont. Moreover, OEO is lean and cost-effective. This part of the system is not broken and should not be dismantled. As a provider of life-saving shelter, Groundworks has worked to raise funds to build a new shelter to help meet a priority of this administration, adding critically needed shelter capacity in Brattleboro, identified as a high priority region given the numbers of Vermonters accessing the GA motel program in our community. In partnership and consultation with OEO, we have built the operating pro forma for the new shelter with the understanding that operations funding would be available to staff it when we open our doors in FY27. Our counterpart agency in the Upper Valley has done the same, leveraging local community dollars to meet the extraordinary need for sheltering Vermonters in vulnerable situations. I come today representing a network of shelter providers in Vermont who do incredible work, writing housing case plans that address barriers, streamlining prioritization and applications for scarce permanent housing opportunities, and navigating the many barriers to achieving permanent housing in our gridlocked crisis-level housing market. It is imperative that we not conflate the many challenges of the GA motel program with the service-rich and high-performing work done by shelters across the state. We cannot afford to have these essential services reduced for the people who need them, nor can we justify the additional administrative costs associated with dismantling systems that have been built over decades, only to rebuild them in ways that will serve fewer people. I'd like to underscore the shelter system is not broken and does not need fixing. Thank you for your consideration.
Thank you, Libby. And if you could please send us your comments electronically and we'll post them on our webpage.
Thank you. I sent them to Kiki this morning.
So in the interest of time, I think we're going to listen today and then as needed, we'll come back with questions. That would be very helpful if you could make yourself available another time for that.
Wonderful. Thank you.
We might have time at the end of the day. You never know. If you can stick around, that's great.
Okay.
So Jonathan Farrell, here you are.
Hey folks, thanks for making time today. I really appreciate it. Jonathan Farrell, the Executive Director at COTS in Burlington. That's the Committee on Temporary Shelter, but please call us COTS. It's what we prefer. For those of you who don't know me, I've been with the agency 14 years, filling a variety of roles in homeless prevention, rapid rehousing, housing programs, program design and implementation, operations, and now this role. For COTS, we are a homeless service provider. We operate several shelters, a daytime drop-in center. That program has seen an influx from 500 unique individuals in fiscal 23 to 1,780 in fiscal 24. We operate a 36-bed year-round shelter known as the Way Station. That is a housing-focused program. We are operating a winter warm shelter this year with 40 beds. We operate a transitional housing program with 7 beds and several outreach programs and 106 units of affordable housing. I also want to highlight motel outreach team that's been in the field since 2020. We have been connecting with households in those motels, 1,930 households we've worked with. We've managed to house 266 households from the motels into permanent housing. For H91, a couple things I'd like to highlight. The bill was written by the House Human Services Committee without any testimony or service provider input. Comments that we provided to Health and Human Services Committee were neither acknowledged as received or posted as part of the process. This bill, from our opinions, upends a very functioning system that includes allocation of funding, statewide guidelines, superior support, technical support, and safety support from OEO, flexibility to changing needs in the community, and a very good, solid, robust rent reporting, billing, and payment system. It's important to note that agencies like COTS are laying out the operating cash and then being reimbursed quarterly. I know that I can count on my HOP payments being paid timely and in a good fashion. This week alone, we submitted $760,000 of reimbursements to OEO and NHS. And I know that those will come in, and we count on that coming in. We see no savings in duplicating this infrastructure that exists at OEO into 5 regional agencies. I've been working closely with CEOEO for the better part of 14 years. They're excellent community partners, but I think we're asking a lot of our CAP agencies to ramp up an entire fiscal program to manage the money coming into them. I also think that this money will be tapped, as Libby said, for administrative costs that are going to come out of the direct service dollars eventually year over year. This bill risks implementing 5 disparate service areas, which could negatively impact one another. Think for a moment, if one area offers motels as an emergency relief valve and another does not. We already know our guests and clients move from region to region throughout the state. So I think that as we have different services in different areas, that's going to be cause for concern. And it's not going to be a uniform approach. I do not see this bill as increasing access to services for Vermonters. I see this bill as rearranging a funding stream. This bill risks substantial state and private investment in projects such as our shelter expansion plan and others in the state. Our plans have been undertaken in concert with OEO over a long period of time. We are acquiring a new building. We are renovating space.
Someone is zoomed in on the road.
Anybody in the room who's got their
I don't-
audio on this, yeah, sounds like.
Way to go, Frank.
Nail.
As I was saying, our plans have been undertaken in concert with OEO over a long time to ramp up a new shelter, expand its capacity. And with that comes all of the services that HOP provides, housing navigation, and the shelter staff to run a larger shelter operation, which is a priority. So we really count on a sort of level-headed, long-term view of what's going on from our state partners. I can see that this bill could create conflict of interest. I have a lot of faith in a lot of our community partners, but it does set up a system in which the agency overseeing the allocation and distribution of funding is also a recipient of funding. And that could be tricky, depending on who's filling those roles in the future. We've had some talk about the COCs being very involved in distributing funding. And after 14 years of attending those meetings, I can say that those meetings and ideas can be mercurial, right? There can be a great idea one month and everybody voted on prioritization for veterans. Several months later, we have to prioritize families. What if that happens to the funding sources for these programs? It takes a long time to invest in and a long time to ramp up and run effectively. I do take issue with some vague language in the bill that states, quote, Vermont's emergency housing statutes, rules, policies, procedures, and practices be modeled on Housing First principles. I see Housing First as a specific program designed for mental health and substance use needs. It involves 24/7 availability in person of medical professionals, mental health professional, substance use disorder professional, and peer support worker for each person enrolled in the program. The Housing First model also assumes that housing is paid for and that a participant may need to be relocated from one unit to another when the tenancy is not done well. I support Housing First as a program. My colleagues at Pathways do an excellent job, but I do not support it as a mandate or service across this. I do agree that the GA housing system is less than ideal. But I want to speak a little bit about our experience, especially this winter with the warming shelter. We proposed 30 beds and we have over delivered with 40 this winter. And the biggest lesson in operating as low barrier shelter is that just about every guest that we see could benefit greatly from a 24/7 residential care setting. As a state, we should be providing a setting which not only meets people's basic needs, but also physical, mental health care needs and substance use disorder treatment provision. I want to be clear, the folks in the shelter that we're serving in this low barrier setting, we are seeing folks with active auditory and visual hallucinations, folks with acute substance disorder, folks with mobility issues in walkers, canes, a person discharged from back surgery at the hospital to the low barrier shelter. Not one, but 2 women presented at Morgan Station in the 8th or 9th month of their pregnancy who had been sleeping rough. We need some medical and basic care, not just more shelters. There is rarely a night at the morning shelter that the ambulance does not come. This generally happens more than once for medical reasons or for mental health reasons. Just the other night, 4 ambulance calls to the overnight. Our staff takes it in stride, but it's a lot. I would ask that we as a community consider putting GA emergency funding into 24/7 transitional residential treatment centers where folks can live, receive dignified daily care like showers and meals, medication management, medical care, and substance use disorder treatment. I think we should do so by harnessing the full capacity of the State Department of Health, Department of Health Access, the Department of Mental Health, Disabilities, Aging, and Independent Living, and the Department of Corrections. That's the kind of action that will serve the most vulnerable folks to the highest degree. I would ask that we consider leaving HOP in the capable hands of OBL in that management system that exists. And lastly, against the nutty federal backdrop right now, reorganizing all of our funding sources is just one more draw on our back that's going to stretch our community really thin. Thank you.
Well, thank you. And again, please send us your written testimony
Sure.
so we can get it up here. Because you've made some very specific suggestions. Obviously, we have a bill in front of us. We aren't starting de novo, so we need to hear constructive criticism and help. I do want to say one thing, that your comment early on, I understand your frustration with not being able to testify on the bill as it came to us from the House. And I would feel frustrated myself if that had happened. But I do know that the bill got to us very late. So the time available for us to complete work and for the House to complete work is really limited. So have your ability to be here, I hope, is helping to compensate for your inability to be upstairs. But
Absolutely, I appreciate the
yeah,
opportunity.
good. Thank you. That's great. All right. Because I don't, we as legislators, we work really hard and we don't try to turn people away. Sometimes that happens and there it is. Like, it's like turning someone away from the shelter. We don't want to do that, right?
Understood.
Thank you, John.
May I ask a question?
No, we're not doing
Okay.
questions
All
right
right,
now,
Joe.
Senator.
Me
Sorry.
too.
We'll pick up the conversation, and I know that you'll all be either up there or in the room with us to help us through the bill. Thank you.
Thanks.
Frank, now you can sit. You've been wanting to get there the whole time.
Is there a way to share when I'm in the room?
Yes,
Okay. I don't have that feedback.
Kiki will get that to you.
I have the link, it's just I thought I had my mute on and the feedback came installed.
Oh, no, you're not up there yet.
I guess, could you move me on?
And we have something, I see you have something here from the Alliance, but it's not coming up. So that's the problem between, I guess, us. Kiki.
Yeah, this is an appendix to the testimony I submitted this
Yeah,
morning.
so I'm having trouble
Yeah.
getting your testimony. Maybe I'll
Okay.
refresh and see what happens. Go ahead. Go
Well,
ahead.
thank you all so much for the opportunity to testify. My name is Frank Knack. I'm with the Housing and Homelessness Alliance of Vermont. For those not familiar with HHAV, we wear two hats. One is exactly what we're doing in this room today. We advocate around policies that have to do an impact on unhoused Vermonters. So everything from shelter and services to housing production. We also work on issues related to substance use, harm reduction, et cetera. The other hat we wear is we are the collaborative applicant for the balance of state continuum of care. And so those for not familiar, and I described it a little bit more detail in our testimony. Each state has one or more HUD mandated and funded continuum of care, which really functions as the homelessness response system that receive federal funds and through coordination and planning, bring together relevant partners and develop a response plan to addressing homelessness. And just this past year, through the work of CCHA, which is the continuum of care for Chittenden County, and then the balance of state continuum of care, which we serve as collaborative applicant for, so functionally staff, those two entities brought over $7.8 million of federal funds into Vermont for discrete projects to address our housing and homelessness crisis. So the reason I have this spreadsheet up is I really want to kind of set the stage for what H91 is sitting within in Vermont right now. And so as you can see, from this data, we have large numbers of unhoused people across all districts in Vermont. And so you can see from this, I think, not only the total numbers, but also the specific types of needs individuals have. So we're looking at nearly 50% with mental health, large numbers, 1 in 5 with a developmental disability, nearly 1 in 3 with a physical disability. And so that are the type of people that this legislation would impact. At the same time, right now, Vermont's entire statewide shelter capacity is 655 households. And so you look at that number 5,000, and then you look at the actual numbers on the ground in terms of shelter capacity, 655, and you see the kind of gap and the problem that we need to address. And so I think from our perspective, one of the key things we think with H91 is as we're working through this process, as we're developing a system, we need to ensure that we do not make this crisis worse. And so that once we get through planning and implementation, we're coming into a new homelessness response system that has actually expanded. And so I think from our perspective, there are a couple of key things that we urge this committee to do in the FY26 budget to really mitigate the likelihood of more unhoused people becoming unhoused in Vermont. And so both of which I note in our testimonies. One is ensuring that the GA program is fully funded. And so as you note from this data, over 5,000 people in coordinated entry right now, 655 shelter beds. The GA program has served as the core backstop for the folks that this body has deemed vulnerable. So we're talking about seniors, people with disability, people fleeing domestic violence, people with children. And so without that GA program, there is no safe place for these individuals to go. And we urge this committee and the legislature to ensure that starting July 1, we have funding available to continue the program during this implementation and planning phase without caps, because all the caps do is push the problem off. So like we saw last September and like we saw just a couple of weeks ago, when we're exiting hundreds and hundreds of people into a system where there's zero capacity for them, and these are the most vulnerable folks. So I think that's one key request that we have. The other, and which was also in the House Human Services recommendation, is $3.75 million to continue to fund 33 critical case management positions that are currently funded through ERAP, which are federal funds that will drive into this fiscal year. And so those are positions that are helping to keep people in their homes. And so if we lose those positions, we're going to have more people become unhoused. So moving on to H91, more specifically, we've been having a really productive conversation with CAPS with all the various partners. And so I feel like my conversations are a little bit high level, and we'll have more specifics hopefully within the week for y'all. But I think, and I really appreciate both what Paul Dragon from CVOEO had said earlier last week, was that they really want to work within the existing structure. And so I think Vermont already has a regional response system. We have it through the local housing coalition, through CCHA. And so this shift to the regional approach is something that has already long existed in Vermont. But we need to ensure that this transition happens within the existing structure. And so those COC structures exist because they're HUD mandated, HUD funded, and will continue to exist. And so we just need to ensure that this new system works within that. And we've heard really positive things from the CAPS that that's exactly how they really see this moving forward. I think the second, and this was lifted up, I think both Libby and Jonathan, is that, regardless of whatever this new regime is, if you don't fund it, the problem doesn't go away. And so we need to ensure that this legislature is committing to the funds necessary to whatever the plans are that are developed through this process. And without doing that, we're just going to be passing off the problem to a new nonprofit agency to deal with. And the result is we're going to be harming unhoused Vermonters perpetually down the road. And finally, I think we need to ensure that there's continued state responsibility. The fundamental role of government is to ensure and protect the people, their residents. And so I think from our perspective, the buck stops with the state. We need to ensure that the state maintains both responsibility and accountability for solving this crisis in Vermont. We like some of the language that was put into the bill, creating that process, but I think just making sure that that is clear in statute would go a long way. In addition, the state has the ability to exercise massive state power when there are both planned and unplanned crises that they can bring in to help respond. So I think for those reasons, we really urge the committee to follow these recommendations, and I'd be happy to respond to questions folks may have offline. And we'll definitely work on getting concrete recommendations with the language as soon as possible as well.
Just for 2 seconds. I'm very bad. Okay. So,
So we have that's it.
Oh, yes.
Oh, that's great.
Yeah, I didn't.
I'm going through 5 or 6 pages that you sent us, and
So I figured you would all would read it. I didn't need
No,
to read it verbatim.
I did.
I just wanted to hit the high points.
Good, thank you.
Yeah.
That's great. Perfect.
Thanks.
And yeah, as you know, once we start working on the bill, we need all of the brains that are in this room to help us do that. Can't do it alone. So you're all in charge of helping us, responsible for helping us. Doesn't mean we're going to agree with you. Leave it here. Sarah Russell. She's up there. Not there. She has a Sarah. There you are. Welcome.
Good morning. Thanks for having me.
So why don't you just go right ahead with your testimony?
All right, efficiency, I like it. So for the record, my name is Sarah Russell, and I am the Special Assistant to End Homelessness for the City of Burlington, and I serve as one of the 2 co-chairs of the Chittenden County Homeless Alliance, or CCHA. CCHA serves as one of the 2 HUD recognized continuum of care for the state of Vermont, which Frank mentioned just a moment ago. Annually, we respond to a federal HUD continuum of care program, NOFO, by issuing an RFP to providers, ranking priority projects, and submitting collaborative applications on behalf of our CROC.
Can I interrupt you?
Yes.
Just every time I read about this and think about this, I ask the question, has the federal government done anything to eliminate the NOFO, to eliminate the continuum of care funding? It's all still there. The little cloud of authoritarianism hasn't reached you.
It hasn't. We're hiding. We're hiding under the cloud.
That's good. Stay there.
Just don't say it too loud.
I didn't say it. Go ahead, sorry.
Over the last few years, we have honed our process of development of the collaborative application and developing ranking priorities for these projects and strengthened our procedures around this, which has resulted in us being able to bring in Chittenden County over $1.2 million to support no barrier rental assistance for permanent supportive housing projects serving chronically homeless households, and additionally rapid rehousing assistance for households fleeing domestic violence, and to provide funding support to our local coordinated entry system and for database management. I share this with you today because operating under regional funding programs is not new to COC work and has been in place for many, many years to bring federal funding to our local communities. This also seems consistent with the intent behind House Bill 91. This will not be implemented without challenge, but under H91, state funding can go to the communities to align with local needs and priorities. We have proved this method of regional funding can be very successful, as demonstrated by the COC ranking process and collaborative application process I've outlined here. Let's build off how COCs are defining local priorities and aligning funding to have the greatest impact, and to develop a process that mirrors distribution of state funds to those of federal funds. CCHA stands ready to work in strong collaboration with our CAP agency partners, and I look forward to working alongside our CAPs during the planning year to develop a cohesive, transparent, and fair system. Because providers within the CCHA hold a diverse set of opinions, I want to touch on several areas of hopeful growth as H91 moves through your committee discussions. It is critical that sustainable funding be provided to sustain administration for our CAP agencies to conduct a thorough and thoughtful annual community needs assessment. CAP agencies will be in the role of providing ongoing oversight and monitoring of local funding awards, in addition to providing support and leadership within the regional structure. For far too long, as you all know, and as you've heard this morning, we have neglected to invest in capacity building and backbone leadership for our nonprofit organizations. For this proposal to be successful, we must ensure adequate thought and investment is established not only at the forefront during the planning year, but sustainably over time. I would also like to stress the importance of equitable regional allocation. For example, CVOEO served 23,000 people in their catchment area during last calendar year, which represents 50% of Vermonters served by all CAP agencies statewide. Our Chittenden homeless numbers alone represent well over a third of the total statewide homeless population. Our unsheltered numbers reach as high as 400 people in the warmer months and remain stable at 250 people in the winter months. These numbers far exceed the reports from other communities. However, it is imperative to ensure that we all have equitable funding to be able to have an effective and adequate homeless response system based on data. Further, the ability to enact adjustments in allocations will be critical as populations fluctuate region by region. One of the loudest reservations community partners have voiced to us regarding H91, which the City of Burlington also shares, is more philosophical in nature and no less important. We must work together to identify how to ensure the governor and AHS leadership will continue to hold homelessness as a statewide problem to solve. Our communities cannot feel abandoned and isolated in this work. The homelessness crisis requires the attention and support from our state leaders. I would like to challenge us to identify ways to continue to engage the governor and AHS in this work. Even if the administration of funding shifts to regional organizations, the state could and should still continue to provide training of best practices, monitoring activities, technical assistance, legal support, and ongoing monitoring of impact and funding. Finally, I wish to raise an important question about the General Assistance Emergency Housing Program for FY26. While I understand the proposed timeline for H91 proposes changes geared into FY27, it speaks nothing to how we will manage FY26. Over the last few years, you have heard from dozens of service providers begging for sustainability within the emergency housing program. They speak on behalf of their clients who are forced to live with uncertainty and the crushing anxiety of a program that has changed more times than any of us can count at this point. I would encourage you to closely consider how the 80-day cap will place us all right back in the same state of chaos and Groundhog Day crisis this coming fall, should nothing change. One of the main premises of H91 seems to be focusing on a more stable, human-centered system, able to exercise proactivity, be nimble enough to pivot. To lean into this innovative method, providers cannot continue to respond to seasonal crisis. Personally, my policy and systems level work comes to a halt to hand out tents to families moving into a city-owned campground, to open shelters when it's dangerously cold, to create last-minute MOUs, contracts, and purchase orders for nonprofits to obtain basic needs for another mass inflow of people into unsheltered homelessness. Now is the time for intentional planning and deep collaboration. Therefore, I'm imploring you to ensure that there is at least some level of stability for vulnerable households within the emergency housing program for FY26 by revisiting the 80-day cap so that we can fully commit to endeavor in the support and work together. Thank you.
Thank you, Sarah. And I think there are some suggestions that you've made and some concerns that you have, and that each one of you has expressed that we're going to need to come back to. So I appreciate your sharing those with us. It's great.
Thank you.
And we're just going to keep moving to Kim Ennetsberger from Lamoille. And there you are.
Hello.
I love Zoom because everybody magically appears when we say their name. It's great.
In a place.
Thanks for being here.
Thank you. Thank you for the opportunity to speak with you today. My name is Kim Ennetsberger. I am the Executive Director of Lamoille Community House, a homeless shelter serving people experiencing homelessness in the Lamoille Valley. We also run the Recuperative Care Program, which provides medical respite beds for people with higher health needs. Soon we'll be expanding our services to include family shelters in Lamoille County. Simply put, shelter work is our work. I also serve as the co-chair of the Balanced Estate Continuum of Care. As I speak today, I'll let you know which hat I'm wearing. I'm going to start with my COC hat on. The Balanced Estate COC represents a wide range of partners and providers working together to end homelessness across our region. While I can't speak on behalf of every member, I can speak to the critical role COCs play in maintaining a coordinated, accountable system of care. I'm glad to see the COCs and local housing coalitions recognizing this bill. If H91 moves forward, the COCs need a meaningful seat at the table, and we are ready to work collaboratively to define what that looks like. Now I'm going to put my shelter provider hat on. This is the hat that I've worn the longest, so it feels like part of me. As a shelter provider that receives HOP funding, I have serious concerns about the way H91 proposes to restructure oversight of that funding. In every version of this bill, one question keeps coming up for me. Why is OEO and HOP funding part of this bill? H91 seems to conflate the GA Emergency Housing Program and HOP, which are two very different systems. Yes, we can agree GA needs improvement. If moving GA administration to the CAPS is being considered as a solution, then I would urge you to look at the GA task force recommendations for guidance. I am cautiously open to that idea as long as it's not rushed, is thoughtfully implemented, and the CAPS are supported to take on the work. But that rationale simply doesn't apply to HOP. HOP is a vital, high-functioning program. In fact, it's one of the few well-functioning systems we have. The Office of Economic Opportunity, OEO, has built a strong statewide program with clear standards, oversight, and accountability. OEO ensures consistency across the state through a system that includes grantee monitoring, building inspections, technical assistance, advisory groups, file reviews, reporting requirements, resource coordination, and much more. In short, OEO is a core accountability partner for our state's shelter provider network. They have a statewide view of our system and the knowledge and expertise to maximize state investments in our homeless prevention and response system. Trying to replicate that structure across 5 different CAP agencies would cost more, increase administrative burden, and create inconsistency in how services are delivered. Not all CAPs are equally resourced or structured. Some are more robust and more experienced in homelessness response and prevention than others. And that's not a knock against CAPs. We love them. It's just the reality that this bill doesn't seem to account for. If H91 moves forward without significant dedicated long-term funding for that additional administrative burden, then the cost would fall to existing HOP funds, meaning less money for shelters like mine, who are providing an essential necessity for the people we serve. The other equally concerning possibility is that not all of OEO's functions would be replicated, leading to less accountability and oversight, and a weaker, more fragmented system of shelter provision. Another issue with the bill is the conflict of interest in appointing CAPS as both HOP-funded administrators and recipients. What checks and balances would be in place to ensure that funding decisions are made fairly and transparently? All of these things keep leading me back to the same question: why this and why now? We are already living with enormous uncertainty due to the instability at the federal level. Why is Vermont adding to that uncertainty for those of us doing the hard daily work on the ground? Many of us live and breathe this work, and we were not meaningfully consulted when this bill was drafted. And I understand that sometimes things move quickly and there may not be enough time to consult everyone. Moving forward, I urge the committee to ensure that our state shelter providers have a meaningful seat at the table as discussions around this bill continue. The inclusion of HOP in this bill feels like it came out of left field, and without clear explanations, we're left to speculate. Is there a threat that future cuts if we don't comply? Is this politically motivated? I hope not, but in the absence of transparency, we're left with whispers in hallways instead of facts. I'm also asking for transparency. I'm asking that if you see a problem in our system of care, you talk to us. We're here, we have ideas, we care deeply about doing this work well, and we will help find solutions if we know what problem you're trying to address. For example, the GA Emergency Housing Task Force already developed a set of thoughtful recommendations, which seem to have been overlooked entirely. Frankly, this is not a good look for the state. It feels like an attempt to distance the state from its responsibility to care for its most vulnerable people. Our homeless population is your population too. These are Vermonters, and yet they're often treated like a problem to be solved rather than people to be supported. If the energy behind H91 were redirected towards root causes like building more affordable housing and creating sustainable funding streams for that, we'd be in a much stronger position. But instead, we're once again reshuffling programs without addressing the fundamental issue, the housing crisis. This bill won't solve that. Moving HOP funds to CAPS won't build more units. It won't guarantee better services. All it does is shift responsibility from the state to nonprofits, further removing accountability. And let's be clear, shelters are already part of the solution. One of the reasons the motel program struggles is because people are placed in isolation without oversight or support. Shelters provide connection, safety, staff support, and a path forward. This bill does not address either of these things. It does not add the needed resources for the GA program to be successful, and at the same time, it risks the stability of the shelter system. Restructuring the high-performing HOP system that provides shelter to those without homes will only cause harm. I simply can't see the benefit, and none of my colleagues running shelters do either. If GA gets restructured, I encourage you to include the funding necessary to ensure that people utilizing motel vouchers are well supported by recommending a budget increase for OEO so critical case management positions funded by ERAP do not disappear in June. Thank you for your time and for your willingness to hear from those of us on the front lines. I urge you to reconsider the inclusion of HOP in this bill and to continue to speak with all groups that are doing the work every day that would be impacted by this bill. I do believe that Vermont has the potential to be the kind of state that sees every one of its residents as equal contributors to our society. But we'll only get there if we remember that every new policy we come up with affects real people and has the potential to cause real damage. When we make decisions without consulting the experts in the field, we risk harming the organizations that do the work and, more importantly, the people that they are meant to serve. Thank you.
Thank you, Kim. And not only do bills potentially cause real damage, they might also cause real good, so benefit. But thanks, and please send your testimony in.
Will do.
We need it. Where are you located in Lamoille County?
In Hyde Park.
Ah, okay, I thought so. All right, good, thank you.
Yeah, they're literally around the corner.
There they are. Okay. Okay, so Josh Davis has been waiting patiently, and here you are. Thanks for being here.
Thank you for having me.
Okay.
I'll try to be concise.
And we have your testimony online,
That's testimony.
and you're representing
I'm
a
Josh
whole
Davis,
bunch of unknown people.
unknown people. That's right, new entities. So I'm Josh Davis from SEVCA, and on behalf of the Vermont Community Action Partnership, I'm also here with Jenna O'Farrell from the Northeast Kingdom Community Action, Allison Calderera and Sarah McMullen from Capstone Community Action, Paul Dragon from CVOEO, and also Tom Donahue from Bennington Rutland Opportunity Council. So thank you again for the time today to testify and also for taking seriously our feedback As the community action agencies that would be tasked with administering the new DHEART program as envisioned in H91. We want to say at the outset that we have discussed H91 at length, and we do believe as the community action agencies, we can do what is envisioned in H91. As we've said multiple times now, it will be critical that we have the time and the funding necessary to stand up the new DHEART program. And with that support, we will serve as the lead agencies in our communities, working alongside our partners to affect community change. DHEART is well within our mission, and it is aligned with all of the anti-poverty work that we do as community action agencies. All 5 of us are committed to this work, and we are also committed to having support at the level of our statewide partnership, the Vermont Community Action Partnership, to help ensure statewide consistency and also so that we can support one another. Our community action agencies have a proven track record of standing up statewide programs quickly and efficiently during difficult times. We wanted to list just a couple of examples for you. During the COVID pandemic, SEPTA led the way in standing up Everyone Eats, which supported hundreds of people in restaurants across the state in getting prepared meals. Brock led the startup of our micro business program, which includes one-to-one business coaching, group workshops, and help with building a business plan and building up credit for entrepreneurs to start a small business. NECA led the way on starting up the Digital Equity Program, which helped Vermonters get connected to the internet. Capstone's Disaster Case Management Program was established to assist survivors of the July 10th and 11th, 2023 floods with direct services and long-term help as they recover from the disaster. And CVOEO's Home Family Housing Voucher Program has provided up to 200 families with 24 months of rental assistance. Families are referred through the coordinated entry process with local organizations providing housing, navigation, and retention services across the state. These are just a few of the examples, but throughout the 60-year history, community action agencies have been here for Vermonters in need. We've been stalwart partners with the state to provide support and services to help lift people out of poverty and achieve stability and security in their lives. In the testimony, we provided a link to our 2023 annual report with more details on that. So the opportunity before us. While we appreciate concerns about the speed and the process of H91, we're more concerned about the alternative or the lack of one if we don't act now. Over the past few years, the administration's primary strategy for managing the emergency housing program has been to narrow eligibility combined with limiting the number of people served. This approach has repeatedly led to harm on individuals and families, confusion, distress, and operational disruption. It is safe to assume this approach will continue if we don't change the system. We believe this moment offers a rare opportunity to transform a fragmented and reactive system into one that is coordinated, compassionate, and community-led. If we miss this opportunity, it may be years before we can attempt such a shift again. It will be necessary to unwind a very large, well-embedded program from the state, and we don't yet know what we don't know about all that makes that happen. We don't know what the scope and breadth of the administrative support is now for that current system, and it is unclear whether the funding that is currently paying for that administrative support will be transferred to our community action agencies so that we and our communities will have the financial support to assess, plan, and implement so that we can be successful. We don't know yet what will be needed to administer the new DHEART program once it is in place, because we hope it will look very different from the current system. What we do know is that it will take a bit of time and investment to stand up the new program and do the necessary and valuable work of bringing our community together to have deep discussions about what is possible and how we can better serve everyone who needs support and services with regard to preventing homelessness, providing shelter and support to those who are unsheltered. We need a realistic phased timeline. We've outlined a 3-year phased implementation model. FY26, regional planning and infrastructure development. FY27, community action agencies administer the GA emergency motel program, while OEO continues to administer HOP with continued planning and infrastructure development. then in FY 28, full implementation of BHART, including HOP responsibilities. This timeline balances urgency with realistic expectations, allowing us to mitigate risk and build buy-in. The transformation is ambitious, and it's achievable if we take the time to do it right, and if we are allocated the funding that will allow us to stand up this new transformational program in a way that leads to success. Why it's worth the investment? BHART is a system shift with potential for lasting impact. It embodies client-centered access that reduces stress and tailors support from the beginning. Streamlined intake and assessment that reduces administrative burdens, regional flexibility that expects communities to design what works locally, integrated services that center coordinated case management, and opportunity for innovation and unlocking creative community-based solutions. If fully resourced and thoughtfully implemented, BHART can reshape Vermont's emergency housing response for the better. Funding needed. We want to take a moment here to clarify for this committee that VCAP has two separate and distinct funding requests for FY 26 at this time. Our original funding request, which was developed prior to the executive order and prior to the shift in H91 to this transformational BHART program, is still a real need for all 5 of our agencies. That is for an additional $6.025 million through the HOP program. And you heard testimony from Allison Calderera last week about that request. Our funding request related to H91 and to the transition to BHART is for the $6.83 million. We brought this number to you last week after all 5 of us together built out a budget for the transition year. That would need to be annual funding for the next few years. We want to acknowledge the limitations. We want to be clear, BHART will not fix the housing crisis overnight. The lack of affordable units remains the most significant barrier to transitioning people out of shelter and into permanent housing. Average shelter stays are increasing, and even with the best planning, some individuals will remain in shelter longer than ideal. But BHART offers a framework that is more stable, more flexible, and more equitable, and could give us the tools to respond more effectively. Guiding principles for regional planning. We believe eliminating the confusion of the conflicting timelines in H91 as passed by the House and moving toward the inclusion of a framework of guiding principles for regional planning in the bill would lead to a better statewide plan. That would also involve eliminating the advisory committee in H91 as passed by the House. As written, it is unclear how the advisory committee would intersect with the regional and statewide planning processes. And it would add an extra layer of work for everyone who is already involved in the regional and statewide planning processes. We envision each community action agency leading a needs assessment and regional planning process that would adhere to these principles and address them in the regional plans. Of course, we fully expect all of our current and hopefully new community partners to be fully engaged in these processes. We've said it many times and we'll say it here again, that the continuum of care and the local housing coalitions are essential to the success of BHART and must be fully engaged in the transition of ongoing work moving forward. Also, if we're going to develop a different and more far-reaching community needs assessment and regional plan that is focused on housing and homelessness, we need to include the faith community, hospitals, municipalities, libraries, regional planners, and other community groups. And all of that will take time and outreach. Of course, we also would want to include people with the experience of living with unsheltered homelessness and make sure they have the opportunity that work for them to provide input and feedback. We presented these guiding principles last week as a starting place for discussion for your committee and other stakeholders, including DCF, to offer a framework for BHART that would guide the planning process and also the administration of the program. We do not believe that this is a comprehensive list of guiding principles, but it's a good start. 1, provide equitable and timely access to emergency shelter through the use of coordinated entry assessment. 2, provide integrated person-centered support services. 3, provide shelter and supports with dignity and safety and include a required housing plan for everyone in the system. 4, strengthen regional capacity through planning, collaboration, and accountability. 5, promote dignified, trauma-informed, and culturally responsive care. And 6, integrate systems to address root causes of poverty and homelessness. Rulemaking necessary for BHAR.
So I'm gonna ask you, there's a lot here that you're going through that is really a replication of kind of an overview of what's in the bill. If you could, because you've got 9 pages here.
I think 11.
Yeah, and you've got all the others, all the comparative analysis at the end. I saw that. So if you could just summarize, I think, if you have specific suggestions, that would be helpful, because I'm reading it. We're all reading it,
That's right.
and it is helpful.
So specific suggestions would be to highlight the pieces that are here. I want to make sure that we're setting expectations about what this is.
Yeah.
Also aspirationally of what it could be, and also what it is not. And I think having that at the forefront is vitally important. We also wanted to include specifics around the timeline. As you've heard, and we will continue to emphasize, the timeline is extremely important. We want to propose that this is the transformation of the system. This is not just the administration of what is currently happening, switching from the state to CAP agencies. We put the graphic in here about the timeline. It's also very important that we note the benchmarks and outcomes, performance indicators. There we are setting expectations. And inspired by Senator Cummings, we wanted to walk through what a client experience was in the current motel program and what the potential could be with the BHARS program. It's centering that on the connection to case management, but broadly speaking, not just limited to a housing case manager. There are a number of needs in the system now.
That's great. All of this is really helpful. I'm looking at the client experience right now.
Yeah. Let's do it.
Yeah, no, it's great. I appreciate the time you've taken to articulate everything that we've actually suggested. That's very good. I will say this, I guess, because I wanted to get to this point here and some closure, but each of you has offered support, and there has been some criticisms. And I guess my question is, you've heard some kind of the critical analysis from folks who may not have been as much involved in the development of the bill as some of you have. And so how do you respond to that? You don't need to do it right now, but we will be going through the bill, trying to bring people together, not to keep them apart, because if we can't start this off on the same page, it won't succeed, regardless. You know, so I very much listen to COTS. I've been following them forever, since Rita Markley put it in place, you know, and they really demonstrate a model for everyone in some way. So how do we incorporate what we've heard from that very experienced organization with other experienced organizations? I look at Paul, I look at Alice, look at John, look at all of you. I know it's there. And I know if we look at the chart of the 12 different organizations across the state that might have capacity, including the CAPS, how do we keep people together?
Mhm.
That's my question, really, because so you get it. We're going to be looking at the bill. We do want to know what are the essential criteria for any organization involved in this. What are the potential outcomes that we expect? What are the benchmarks we use? And I know that there's a lot of conversation in here about what happens to the motel program in 27. My goal is there isn't a motel program. And I think others, we're the only state that has one right now. But we don't want to leave people out in the cold. So how do we bring those two different things together? But enough of me. I'm going to suggest that we wrap for the day. The committee has been really unbelievably engaged all morning. And I just, again, thank you for your time and your work on this. We have a bit of a ways to go in here. We're going to do it. We're going to do it together, I guess. So anyway,